Welcome, SNMA members and guests, to tonight's Fireside Chat of Lift Every Voice in Medicine, Advocacy in Medicine. Tonight's guest will be Dr. Michael G. Knight. He is a physician, healthcare executive, and nonprofit leader whose work has not gone unnoticed. Dr. Knight is a featured medical expert on radio, television, and in print news media. He stands in the academic space as an assistant professor of medicine at the George Washington University. He currently serves as the Associate Chief Quality and Population Health Officer and Head of Healthcare Delivery Transformation. Dr. Knight practices internal medicine and obesity medicine at the George Washington Medical Faculty Associates. He proudly served as the 48th National President of the Student National Medical Association, serves on the National Medical Association Board of Trustees, and is the founder and president of the Renewing Health Foundation. Dr. Knight has received numerous awards, including the American Medical Association Foundation Leadership Award and the National Minority Quality Forum Top 40 Under 40 Leaders in Health Award. SNA members and guests, please help me welcome our esteemed guest tonight, Dr. Michael G. Knight. Pleasure to have you join us, Dr. Knight. We'd first like to thank you for taking the time. Awesome. We'd like to thank you for taking the time to speak with us. We know your schedule is super busy, but just thank you for taking the time to pour into the next generation of physician leaders as we're kicking off our Lift Every Voice in Medicine Advocacy in Medicine series, which is aimed to equip and empower the next generation of pre-medical and medical students with the proper tools in health equity and health advocacy. Dr. Knight, before we discuss our toolkit, might we start with the question that connects us all? Why medicine for you? What life's events or lessons sent you on this white coat journey?
Thank you for that question. And again, thank you for having me tonight. I think that that's a question we all ask ourselves, and it's something that you will continue to ask yourself on those long nights, on those early mornings, understanding what brought you into this field in the first place. For me, it was really a desire to have an impact on the lives of individuals that come my way, but more than just an impact in the way that other professions have. One of the things that you will know is that no matter how much money you have, no matter how successful you are, if you don't have good health, that's all on the line. And it's really a huge barrier for individuals to live their best lives when they're vulnerable in a situation where their health is not optimized. And so as a student, a high school student, volunteering at my local nursing home, seeing individuals who were interfacing with individuals in healthcare, and then also having a love for science, it just made sense to me. I said, I love science, and here is a profession where I could utilize that to really connect with people and help to empower people to live their best lives. And here I am now, doing just that.
And aren't we so happy you took this journey? Dr. Knight, as we stated earlier, you are a physician of internal medicine and obesity medicine. In that field, we know you've seen a variety of health issues. Can you discuss some challenges to health equity, health equality that you currently see? And then what recommendations might you offer to help remedy this?
Yeah, so unfortunately, there are a large number of challenges and barriers to achieving equity in this country when it comes to health. And of course, when we think about equity, we're not talking about equality where everyone is being treated the same way, but actually where we're treating people with the things that they need to be successful. I think one of the greatest challenges is for everyone to understand that health equity or inequities in health disparities are not naturally occurring phenomenon. And I think that is something that is actually something we've talked about more recently. In the past, we would look at things like diabetes being higher rates in the African American community, hypertension, maternal mortality for the Latinx community, our Native American community. We would almost talk about it like it was something to be expected, right? It was something, maybe it was genetics, Maybe it was, the food that we're eating. Maybe it's something else. And never really talked about what is it that has aligned or allowed for almost every health condition to disproportionately impact a group of individuals. And sometimes it's because of access. Sometimes it's because of healthcare and health insurance. Sometimes it's access to monetary funds, but sometimes it's not. Sometimes when you control for all of those things, you still see a disparate effect of conditions. And that's where it comes down to the underlying understanding that this country was not built on equity, right? Our healthcare system was not built to treat everyone in an equitable way. And so when you have a system that disenfranchises and works against a group of individuals, and then you have historical insult to them over hundreds of years, you can't expect that everything's going to be there. So I think ultimately the challenge is understanding the root causes, which include institutional and structural racism, and include gender and sexual discrimination. It includes class oppression, tribalism, and then working from there to say, how do we uproot those things that are still ingrained in so many layers of society, whether it's in education, whether it's in housing policy, whether it's in economics, healthcare access, crime, a variety of things, and what we would often call social determinants of health. But until we address those, we're never going to achieve health equity in this country. And so it's up to us to keep that on the forefront.
Awesome. Thank you for laying that out so clearly for us. And because you have recognized health equity and inequities in medicine, what led you to become a healthcare advocate? What caused you to be someone to step out to help others in this field?
Yeah, one of the things that for me, I'm originally grew up in the Bronx, New York area, and then moved to Lower Westchester when I was a little bit older. But really seeing things in front of you where you have individuals who are battling with disease, battling with access, don't understand conditions, and are dealing with, frankly, sometimes just straight up discrimination in medicine. That makes you use the word upset, or you can use words passionate. It makes you feel like this is not right. And I think that when you have been empowered, when you have received opportunities to advance, to study, to become successful, you can't forget about your community. You can't forget about the people who took care of you and helped to lift you up during those times. And so as someone who is a son of those communities, I got to turn back and say, listen, this is not right. For the fact that the breast cancer, a Black African-American woman with breast cancer, the same stage as a white woman, has a 40% more likelihood for a poor outcome. That's not okay. I wanted to go to the forefront to say, how can we build programs to address this, whether it's through education, whether it's through policy, whether it's through training students and residents and other faculty members to affect change in the way we deliver care to patients, to try to overcome some of these barriers. So that's why I do it. It's home. It's kind of like, why do you take care of your elderly grandmother when she gets older? Because she's your grandmother. Right? So why do I advocate for my community? Because it's my community. And I'm actually advocating for myself and advocating for the community, because when you put the degrees aside, sometimes you're 2 checks away from being best where you started. And so that's one of the reasons why I've stayed in this field.
Awesome. Thank you for that. As my grandmother would say, don't forget where you come from.
Exactly.
And so
exactly.
I love that you connected with that. Dr. Knight, we've all witnessed COVID-19 and the inequalities in the Black and Brown communities regarding this. Can you discuss how COVID-19 impacted the work that you do? Are there any areas that have been strengthened or weakened? Any allies you've had or any critics to your work?
So COVID-19 has been, really a case study. I want to say a case study because when you have a pandemic that's worldwide and and accesses or affects individuals, it's rapidly spread. You start seeing things that otherwise would take years to see. All of the things that we've seen with health disparities, all the things that we've seen with health equity really was under the microscope with the COVID-19 pandemic. From the time when we said, stay safe and stay home, right? Remember that was the stay home, stay safe situation where we told everyone, stay home. The COVID had just come out. We didn't know how it was spread. We didn't know if it was your groceries. We didn't know where it was. But guess what? Everybody could not stay home and stay safe because some people had to go to work, right? You had essential workers that were disproportionately people of color who were in the grocery stores, who had to drive the bus, drive the subway, clean up the areas, working in the hospital. And those individuals couldn't stay home. And then we had individuals who the children were out of school, and they said, well, who's going to stay home with the children? Because I have to work. I don't have an option of working from home. And so you start seeing these pieces, and everyone was saying, oh, COVID-19 is a great equalizer. And anyone who was public health informed knew that that was never going to be the case. But we said, fine, we'll let you go on with that narrative. And very quickly, once we started seeing the racial data, saw that African Americans were significantly disproportionately affected by the COVID-19 pandemic. And everybody was up in arms and scared. Oh my goodness, this is terrible. How did this happen? And it's like, well, how did this happen? It's the same reason why all these other conditions have continued. You go back to the flu pandemic, Spanish flu down in 1918. There were significant impacts on the community from back then. And so 100 years later, we're dealing with the same issue, and we're dealing with the same communities dealing with bearing the brunt of a condition. And so COVID-19 brought to the forefront the conversation that said, enough is enough. This is not equity in health in this country or around the world. The same folks are still dealing with getting the short end of the stick every time. And it forced us to become advocates. Many of us started to do media interviews, television, radio, talking about this issue, trying to understand the disconnect and how that affects the community. COVID-19 also affected how we practice medicine. We had to close our offices for a time. We had to explore things like telemedicine and other ways to deliver care to patients because we couldn't do it in person. And then also financial challenges. Many people think that because of COVID-19 that hospitals were just making all of this money. Well, the reality is that most healthcare organizations, they don't make money from conditions where patients are in the hospital for a long time, needing a lot of care. Mm-hmm. They make money with elective surgeries in and out, and all of that was canceled in the early days of the pandemic. So there was a huge financial hit to hospitals as well. And as someone who's in healthcare leadership, that was something that we had to deal with. And so it was a turning point, but it was also, a pressure cooker. It really, really pushed people to really show their best sides, and some cases not so best sides. But it was a turning point for our profession.
Well, we thank you. We empathize with the struggles of the COVID-19, but we thank you for your service during that time, and the fact that you pushed through is a testament to your character. So thank just you. Shifting the conversation now to race and the idea that race is a social construct. What strategies have you found helpful in combating the prevalent idea that in clinical medicine that race is a risk factor for disease?
Mm-hmm. So, I think we've been able to do that by really just saying, having a factual level set, where we're having a shared understanding that race is not a question. Not like, we would like to discuss how race is a social construct. No, it's race is a social construct, full stop, right? And so then once we are on the same page with that, we can go from there. Because the reality is there is no gene that gives me melanin in my skin, full lips, right? Curly hair, and then gives me prostate cancer, breast cancer, obesity, maternal mortality, infant mortality. Where's the gene? Right? It doesn't exist. And so there has to be something more than the genetics. It wasn't that long. I was in medical school where we were being told that, African Americans were more likely to have high blood pressure because we had like the salt sensitive gene, and then we were eating fried chicken and, whatnot, what have you. And I said, come on now. I'm glad we're no longer at that place. But I think, again, it's just combating it straight on. It's really challenging people to say, well, if it's just the race, if it's just this genetic thing, how is it that all humans are much more alike than we are different, right? There's a human race, like 99% the same genetically. And so why is it that there's so much disparities in health as a result of how someone looks phenotypically? Right. And we know that there's a great range of spectrum in what makes us who we are. And so then we have to say, well, if it's not genetics, what is it that people of color are dealing with that has then led to the poor outcomes? And that's when we can start have a conversation about racism and discrimination and lack of access. And we're not talking about 50 years ago. We're not talking about 100 years ago. We're talking about today. Right. We're talking about what's going on today. We're talking about what happened this morning at a clinic somewhere in America where a patient didn't get what they needed to achieve their optimal health.
Awesome. Thank you. Wow. Okay. So now, because you recognize this and one person can't do it all, even though we would sometimes try because we're so passionate, from your perspective, what are some areas within the Black and Brown community that need healthcare advocacy and health policy changes? And where would you advise a student like myself or a future leader in the medicine to focus our work?
Yeah, I wish there was only one. I wish there was only one or two. But unfortunately, there are hundreds of areas. And what I would tell to students is that as you develop an interest in a specific clinical area, really seek out those opportunities to advocate. I really can't think of a specialty where there's not an equity issue when it comes to people of color in medicine. I really can't think about it. All the way from radiology, anesthesiology, dermatology, you name it. And so for me, as someone who clinically is internal medicine and then obesity medicine is my focus, I've done a lot of work around equity in obesity treatment, food access, nutritious foods, health, housing policy, and zoning laws, and how that affects the food that we have access to, and then how that affects the obesity crisis in this country. And so once you connect those dots, I think it's a greater opportunity for you to be involved and to become passionate about something because it's connected to your everyday life, right? It's not this, separate theoretical thing that you're involving yourself in. It's actually now a part of your day-to-day function. And as busy clinicians, you don't really have a lot of time to do a lot of extra stuff. And so when it's something that's related to the work that you do in your clinical care, then it doesn't feel like extra stuff. It actually feels like an extension of the work that you do in delivering care to patients.
Awesome. That's so encouraging to know that you in this space see a place for us all, that we all find our passion and go that way. And we can improve healthcare. So Dr. Knight, shifting to you and your genotypic being and your phenotypic being, what are some challenges or roadblocks that you've encountered as a Black physician, a Black man in medicine?
So, there are many. I will say that I have been fortunate. I've been relatively successful in my career, and there are many individuals who have had a different story or different pathway of mine, and definitely don't want to discredit that. But even as someone who did well on standardized tests, had pretty good grades, had a supportive family, 2-parent household, there were still barriers that I faced. When you have individuals who are stereotyping you, who don't necessarily believe in you, have not invested in you, then you start seeing that. I was lucky to not have to see that. I went to a predominantly African-American high school. I went to HBCU for college. So I wasn't used to a situation where I was in the minority in my educational settings. Most of my teachers were Black growing up. So it was never we're not going to invest in you because you look like this. I never had that situation until I got out of college. College to me, many individuals who, you're going to choose to go to school that you like, I went to Oakwood University at HBCU in Huntsville, Alabama, and our teachers invested in us. You missed a test, they're knocking on your door, they calling your phone like, what happened? You didn't do well in a class. I had organic chemistry, only C I ever got. And my advisor was like, wait a minute now, come, Michael, what's going on? What's going on? You're doing well. You're trying to go to med school. Why are you struggling? You need a tutor, you need XYZ. And many individuals who went to large state schools never had that experience. If you were pre-med, it's like, look to your left, look to your right. One of y'all not going to be here at the end of the semester. And it's like, it is what it is. The survival of the fittest. It was a very nurturing environment. So going to medical school, thankfully, at that point, I had the confidence for preparation to move forward. But people second guess you all the time. Second guess you. I remember one time I went to I had a research advisor. We had a meeting, and granted, as someone who, I looked a little younger, I was one of the few Black students. I was not going to be walking around in, Air Force Ones and a do-rag at school, because it's just, that's going to fit the stereotype that people are thinking. So, we wore polo shirts, khaki pants, very comfortable. I remember walking into my research advisor's office, and the secretary was like, oh my goodness, we've been waiting for you all day. That light has been out. I'm saying that light has been out. I'm not with maintenance. I'm here for a research meeting. Why would I be for maintenance? I don't have a uniform on. I don't have a name tag. I don't know. Why did you automatically think the only reason I should be here is if I'm working maintenance, right? The thought of me being a medical student here for a meeting couldn't even fathom that concept. I remember being in residency and thinking about applying to the health policy program that I did, the Robert Johnson Foundation Clinical Scholars Program, and having faculty who told me, I don't know if they're really looking for people who have potential. They're looking for people who can do the work, or who have done the work. And I remember coming home and calling my mother at the time, telling her, I was like, I don't know if I'm going to apply for this, because they said they're not really looking for potential, or my advisor said that this person, they're not really looking for potential, and apparently someone ahead of me had applied and didn't even get an interview. And so they said, well, if she didn't get an interview, then you're definitely not going to get anything. And my mother was like, well, no, that means you're definitely going to apply. So I applied, and I got all the interviews, and I got accepted. So thankfully I had the wherewithal and a strong community that even when I was facing individuals that are telling me I can't do something, or second guessing me, I believed in myself. And unfortunately, that's not everyone. You have individuals who are coming from challenging backgrounds, don't have a supportive family, don't have a supportive environment, and it only takes one person to tell them, you're not really cut out for this. This is probably not for you, and then it's over. And so, unfortunately, to too many of our people of color, but particularly Black males, who have that experience.
Yes, thank you for sharing your story so vividly, and keeping in those microaggressions that we often hear, keeping in mind the no's, the difficulty in organic chemistry that we may experience. How can we increase the number of Black males in medicine, and women as well? Like, what do we do to strengthen the pipeline?
So when we think about the pipeline, it's a good question, because unfortunately, it's not an easy answer. It's not the answer people want to hear. People like things that they can invest in and see a return on investment in a year or two. So what do? They do college programs for students who are doing very well. And you do a research summer, and then they, give you little tips about the MCAT, and then you apply for medical school and you get in, and they're like, oh, our program did so well. Well, the likelihood is that you are going to do well anyway. They may have given you some additional tools, but you're already doing well. You already made it to college. Like, you made it through high school. You made it to college. You're doing well. You have advisors who told you about this program or told you about the scholarship, and now you've been successful. Okay, that's good. But what about all the other folks that got left behind in sixth grade? What happens to the other kids who never got to learn or get the kind of access to education in kindergarten? That's where it starts. It really starts in early childhood education. You want to increase the pipeline, you got to start early childhood education. And unfortunately, that is a huge investment. The reality is you do not have equal access to high quality education in this country. It depends on where you live and many times what you look like and what you have access to. And so if you have individuals who are growing in communities that's schools that don't have resources, don't have exposure to health professions, don't even see it as an option that they could even know anybody that looks like them or from their neighborhood that has been successful in this area, what makes you think that they're going to believe that they could just do it? You know, it's kind of like when you meet someone and you're like, what do you want to be? You're like, I want to be an astronaut. And you know that there's only a handful of astronauts in the world, right? So the likelihood that that individual will become an astronaut is very, very low. Not impossible, but it's very, very low. And so you kind of like, oh yeah, you're an astronaut. Wonderful. But in your mind, you're like, yeah, well, hope you have a backup plan or something else. You study science, you study something else, because that's how they think. So, you know, imagine kids growing up and they see being a doctor like being an astronaut. Like, it sounds great, but it's almost fantastical because they've never seen anyone do it. And so if you don't invest in the students so that they not only believe in themselves or believe it can be done, but have access to the tools that are needed to be successful, which includes having positive educational experiences from early childhood.
Awesome. So we need to mold the minds of the youth. We need to get into those elementary schools, into preschools, etc., and show them, right? They need to see who they would like to be, you know? So we've got to start young. Excellent. So Dr. Knight, we know that you were very, very active in the Student National Medical Association. And now you are so active in academic medicine and leadership role. You're in media, print media. How did any of your SNMA skills transfer into your medical career? What would you attribute to that was SNMA? That's where I got that from.
I would say a lot of things. I would say leadership. That came from SNMA. When I was in, undergrad, I was involved in some student organizations, but not in a large way. I think I was like treasurer here. I may have been the president of our honors society in my last year, but didn't like public speaking. Was not trying to be in the front, not outspoken, would get nervous, in conversations. And then I went to medical school and I joined SNMA. This was the first time in a non-HBCU situation. So I'm like, where are the Black kids? And so they said SNMA. So of course I wanted to join SNMA. I was involved, but then also fell in love with the organization that was focused on addressing issues that were of importance to me. And so because of that, I was able to just grow in the organization. The conference calls that we used to have, and you talking to people in California and people in Texas. And then I went on to become a regional director and was traveling around my state to the different schools and helping with programs. And then went on to be national president, where you're in a board meeting and it's Robert's rules and House of Delegates and public speaking. I mean, think about it, planning a conference for 3,000 people as national president. And so now I walk into a boardroom, it's nothing. I would say that started in SNMA completely. I mean, my comfort doing public speaking, that's all from SNMA. I've spoken to thousands of individuals, no nerves, feeling fine. People are like, oh my goodness, you sound like you've been doing this forever. I was like, actually, I haven't. I used to be very, very shy. But through SNMA, I had an opportunity to really hone those skills. I think one of the key pieces here is being able to hone those skills in a safe environment. That's the key here, because yes, I could have done it in many other organizations, but I didn't have to worry about, okay, I'm going to stand up in front of all these people at the SNMA conference and they're going to look at me like, what's this Black boy got to talk about, right? We all have a similar experience. We support each other. We root for each other, right? We ride for each other. Where people you didn't even know were coming up to me like, oh my goodness, you're president. We're so happy with the work you've done and congratulations. It was just so much love in SNMA that just made you feel like you could do anything. And so after coming out of that leadership, and being involved in the National Medical Association, but also the American Medical Association and other spaces that are not predominantly Black, I feel extremely comfortable because of the training ground that I had in the SNMA.
Awesome. So encouraging to hear that. Um, and now from your SNMA presidential leadership to where you are now in clinical medicine, what changes or areas of growth have you seen within the organization are you most proud of? And then also, where would you like to see more growth?
Within the SNMA?
Yes.
So I think over the years, I've seen SNMA really continue to grow and stay up with the new trends, new opportunities. So even look at what we're doing right now. When we were in SNMA, we didn't do anything with video. We just did, conference calls or a conference, but being able to be so adaptable, to adapt to change. COVID happens and all of a sudden we started on Facebook Live and YouTube Live and having the specialty series and interviews and experiences that is really, really top notch. I've been really impressed. Doing a virtual AMEC when other organizations were scrambling to try to do something virtually, SNMA really turned on a dime to get things done. So I'm just so proud of seeing the growth in the organization that's focused on utilizing the innovative ways to reach the members and to reach the community. And I think that's how we can continue to grow, continue to look at how can we best serve and how can we best connect, not just with community, but also with our members so that ultimately they can be successful in their medical careers.
Perfect. Thank you so much. Okay. And also, are there areas in the SNMA that you feel that advocacy-minded students that attend an event such as tonight should become more involved in?
Yeah. So, think about our committees, of course, our national committees, health policy and legislative affairs. I think the regions often still have HPLA reps. I know that's what we had back in the day. So many regions may have individuals in the regional level that do advocacy work. There's usually advocacy programming at the national conference. That's a great, great place to do it. In the past, we've had things like an advocacy day. We haven't had that all the time, but that's another thing to keep in mind, and opportunities to be at the forefront. First time that I ever went to Congress or to interface with legislators was as SNMA president, that came in for a briefing at the United States Senate, and that was on just SNMA. So those are opportunities to be involved and to think about how can we as students who are like-minded and have shared values work together to affect change.
Awesome. And then separate from SNMA, are there other organizations, other partnerships that you can recommend? Are there any books we can read? And are there any trailblazers within social media on Twitter and such that we can follow?
Sure. So there's so many. So I would definitely. So as a medical student, you're very busy. I totally understand that.
Yes.
But outside of SNMA, I do encourage students to be involved in at least one other organization. And the reason I say that is because we can't just keep it all here. We have to be able to work with other organizations and other students so that they can learn, so that they can also be excited and advocates and allies for the work that we're doing. So when I was a student, I was involved in AMSA. When I was, first and second, third year, as I got more heavily involved in SNMA, it was hard to do too many things, but I was in AMSA, went to the conferences, was involved in the House of Delegates. In my later years, in medical school, I joined the AMA, started being involved in the MSS there, and started doing some work around equity issues and joining their minority issues committee. And then as a resident, got heavily involved with the AMA as well as with the NMA in doing that. And so over time, now that I'm serving as chair of the minority affairs section for the AMA, and the same time as I'm serving on the board for the NMA. Right. And so I'm not just talking about things in the echo chamber, right? We can have church now. We can sit here and talk about, we're going to fight for the right and everything. And we're going to clap and say yes. And we can say, that's it, Dr. Knight. And then guess what? We're gonna be done, and everyone else in the world, the country is just gonna go on about their life. We want everybody to be clapping and saying, "Let's get this thing together." And the only way to do that is through collaboration. Books to read. I mean, there's so many. I would encourage you to really push the envelope, particularly if your medical school does not have a strong equity curriculum. Thinking of things like Caste is a great book. Things like Medical Apartheid. Really thinking about, or another book, Just Medicine. Start really peeling back to learn about some of the history, but also the reality of why we have not achieved health equity and why so much of that is rooted in discrimination and racism and bias that's still present in medicine. And so if you're not getting that in your curriculum, I would encourage you all to seek that out.
Awesome. And as far as the trailblazers on social media, we can tag you at the district doc.
Right. So you can find me on Instagram at the district doc, and on Twitter it's MG Knight MD. Some other people, my great colleague Camille Claire has a great following on Twitter. She's an OBGYN department chair at SUNY Downstate. And so many others. David Malbranch out of Atlanta. Uni Blackstock, I'm sure most of you guys know her, has a great following on Twitter as well. So I don't spend as much time on Twitter as I maybe I should, but there's only so many hours of the day. And so, but I encourage you to seek out individuals that inspire you, but also sometimes seek out individuals that you may not fully align with their views, but it's interesting. Like, I'm not going to follow somebody that's in left field, right? I don't need that kind of stress in my life. But if maybe you have a different perspective on something that I haven't really thought about, let me see. You're there. You might bring a different view, a different perspective. Sometimes on social media, we only follow people that say the same things that we're saying. And again, you get back to this whole echo chamber. Really expand your horizon and want to hear from perspectives of different individuals from different backgrounds.
I like that. It gives us an opportunity to grow and to understand different people. Awesome. And then in closing, like what are your accomplishments in your medical career that you're most proud of? We hear tonight you've done a little bit of everything from when you were first in medical school to where you are now at the George Washington University. What are you most proud of, Dr. Knight?
Well, I would say what I'm most proud of in my professional career is my nonprofit foundation. So after I finished my presidency as SNMA, I was president during my 4th year, graduated medical school, went on to residency, and I said, I've just come off of a whole year of planning and programming and building this huge conference and initiatives. We have partnerships with the Kaiser Family Foundation, Boys and Girls Club, and all kinds of stuff. And so I said, I have all this programming. What am I going to do with it? I'm just like a resident now, like a regular medical student. It's like I'm not used to that. And so I went back to New York City, my hometown, for residency. And I said, I wonder what I could do to bring this kind of programming to my own community. And so as an intern, I founded a 501c3 nonprofit called the Renewing Health Foundation. You can find us on social media at Renewing Health. And we are a nonprofit organization that works to do health empowerment in urban communities. Our largest program is one called Purpose and Passion in Pink, and it is a breast cancer education program that's specifically targeted to African American and Latina women to talk about breast cancer education. As we know, the disparities continue with breast cancer outcomes, and we not only have educated thousands of women in the New York City area, but we've also raised over $50,000 in funds for education, as well as in support. We also launched a support network for women who are survivors. And every year we have an annual luncheon where we call it our Celebration of Life luncheon, where women who are survivors and their families come out and celebrate another year of life, but also raise funds. That was an initiative that was personal to me. I actually founded it at the time when my own mother was diagnosed with breast cancer. Thank God she's been cancer-free for many years, was successfully treated, but also it allowed us to say, how can we turn this challenge into an opportunity? And that's how that was born. So I'm very, very proud of the Renewal Health Foundation. Obviously, with so many things that are on my back right now, it's really our volunteers who lead the programming and who have done so much in keeping that organization alive.
That's so beautiful to hear. I forget where I read it, but there's something called turning your pain into purpose. And that's what you did with your mother and her breast cancer issue, and then with your new foundation. So awesome. Kudos to that, and
Thank
much
you.
success in the future for it. And then Dr. Knight, you dropped so many nuggets tonight during our fireside chat. But before we get to the chat and questions that students may have, what words of advice do you have for pre-medical students or medical students regarding what we've discussed tonight in advocacy? Any words of general advice?
I will always say, be true to yourself and be true to your passion. Advocacy is not easy because, again, it's extra work. It's unless you're in a position where you're doing this for a living, you're not being paid to be an advocate. So you have to make sure it's something that you believe in and that you're passionate about, right? So if you are interested in women's health, you want going into OBGYN, and maternal mortality is an issue for you that you want to advocate for that and be passionate about that and build your career around that, you have an opportunity to do that. That's when it feels good. When it's something that you don't really feel passionate about, it's something that, I'll come to the Hill Day. I'll talk a little bit about this. And that often was the case when I did advocacy work with outside or majority organizations. It was, sure, let's talk about this. But when it was something that was hitting home, when it was something that was addressing issues that affected my own community, my own family members, I was passionate about it. I'd be up to 4 a.m. and don't feel it. I'm not telling you to do that. You need work-life balance. But when you can do something and you look up and it's 3 a.m, you didn't even realize that you've been doing it this long because you're so passionate about it and you're driven to do it, then tap into that, and never forget that you have an opportunity that many before you and many ahead of you will never have. And so be thankful for that opportunity, but also take that as a responsibility to have an impact in the lives of those around you.
Awesome. So beautifully said. And then also, do you have any words of general advice for anyone on this journey, even those back in elementary school on this white coat journey? What words of advice would you give to us all?
I would say stick to it. If you believe that this is what is in your plan for your life and you want to be a physician, you want to go into in a medical career, then stick with it. There's no one way to do it. It's like, oh, well, if I don't get into medical school right after undergrad, then I'm never going to be in medical school. There are people going to medical school in their late 30s, early 40s. Okay. There's different paths to success in this area. Don't let anybody put you down. Don't let everybody tear your dream away. Now, you gotta be realistic. Okay. So sometimes people are not trying to tear you down. They're trying to help you understand what the likely outcome may be. If you are failing, if you do have if your GPA is not very well, it's going to be difficult to get into medical school. That's just a reality. That's not making something up. But then there are ways to overcome that. Maybe you do a post-bac. Maybe you do research, do something to bring the GPA up, to get a master's. There's always an additional plan, right? So if one door closes, surround yourself with people who are going to look for the other doors. Not just folks who are just going to say the door is closed, go home. They'll say, look, I'll be real with you. The door is closed, but I'm committed to working with you to find the pathway that's going to make the most sense for your success.
And go through the window.
Right.
Awesome. Thank you so much. So now we're going to open up the chat for anyone who has any questions. I know that we have Ashley Seymour, who is in our medical education committee communications chair. She's partnering with me on this project. Does she have any questions that she can post for us? Okay,
I see one on the stage. So
awesome.
Do you have any advice or work with school administration to advocate for DEI at PWI? So yes. One of the ways is coalition building. When we went through the George Floyd and the really reckoning with racial justice that happened in 2020, a lot of that was not just us. It wasn't just the SMA students, right, who have always been advocating for schools to do more. And they'll say, okay, yeah, we'll give you money to have your conference, we'll do this. But it was when you had all of the students, you had the Asian students, the white students, Indian students, who all were like, wait a minute now, we are tired of this. We are standing for Black lives because Black lives matter. That's when all of a sudden everybody was, having a moment of silence, getting on a knee, all kind of things that were happening at these medical schools. It was because it was a whole coalition of people. And so I would say that advocating for a DEI to PWI, you cannot do it alone. You have to work with other organizations, work with other students, whether it's AMSA, whether it's many other organizations now are available that also have equity in their mission and come as a united front, right? So it's not just you, it's you and this person. Say we may all be from different backgrounds, but we all agree that this is important. Reaching out to faculty members who can support the work. If you have a dean of diversity, a diversity dean or DEI dean, oftentimes that person may only have a title, but not really have a lot of ability to really bring big changes. And so they actually need you to help them do their job. So that would be my advice. Coalition building.
And allyship is so important.
Allyship. And on top of that is having a specific ask, right? What are you asking? Is it just, you need to do more? What does that mean? Or really being very specific in your asks so that it's very clear what we're looking for and this is why it's important and what are you going to do about it?
Awesome. Thank you so much. Do you have another question, Ashley? How would you recommend doing this work without feeling like you're doing the work for free?
So I don't recommend that you do free work. So as a part of your ask is outlining what you want them to do. Maybe you want them to hire diversity program director. Maybe you want them to fund or resource your Office of Diversity and Inclusion. Maybe you want them to put aside funding so that you could bring in speakers. You can bring in individuals to do trainings. You can do all those things. Medicine is a multi-million-dollar industry. So don't ever think that your school doesn't have money. Your school has money because everyone's getting paid on that staff. And so while you may have the ideas, if you come to your school administration and say, listen, I want you to do some bias training, some anti-racism training, and they're like, oh yeah, well, you can plan it. Actually, I'm not. I'm a student. I'm going to class, but this is what you need to do. And you have the funds to do it. So do it. You do it for everything else. And so it's being supportive. It's knowing what's being an advisor and what's doing work, right? You want me to come and be on a committee? I'll come to 1 or 2 meetings. I'm not going to be at a meeting every week unless you're taking time that's protected for me to do that. I'm not a consultant for you. You can pay a consultant to come in to do that, or you can pay me to do consulting to do that. But of course, as a student, I would say, have your boundaries and then always push back. If their response is, well, you can do it, then, you could say, well, when we have had other initiatives, if we've not relied on students to do it, why is this any different? And see what the response is.
Excellent. How do you mitigate the minority tax while doing advocacy work?
I think this is very similar to the last question. I'm not paying taxes that I don't need to pay. I will pay enough taxes. So for me, I have boundaries. I will, as I said, I will do a talk. I talk to our students. I'm a course director at our medical school. I do those things. When I start getting extra requests for be on this diversity chair, this thing, I'm not doing all of that for free. And I'm not doing that and on the burden of my mental health and my work-life balance. And so it's about having boundaries. Yes, just because you're passionate about something, sometimes you got to look in the mirror and say, do I have time to do this? Is this going to take away from my career? Because the students, they will have you doing all kind of trainings and doing everything for that medical school. And when you don't pass your classes, they'll be the first one to put you out. So your priority is being a student first and being supportive, but also being very clear, once again, and using examples. It said, listen, you guys invest and bring consultants and have task force and staff members to do all kind of stuff. This is just as important, if not more important. And so we want to see the investment. If this school is serious about making changes, let's see the money, right? Well, I always say, put your money where your mouth is, right? Let's see the investment. It's not going to be in the back of students that are already trying to make it in medical school.
Exactly. So at some point we have to stand in our truth, and we can't subject ourselves to burnout. So you have to have a certain ask and a certain limit to the work that you can do to protect your own mental and physical health. Next question.
Very true.
Well, Dr. Knight, I don't see any more questions in the chat. So we just thank you so much for opening up our Lift Every Voice Advocacy in Medicine series. You've dropped so much knowledge tonight. And we just thank you for opening up and sharing with us. A message to students: if topics discussed tonight are of interest to you with regards to advocacy, health policy, equity, or diversity in medicine, please connect with your local SNMA chapter and ask how you can become more involved. You can also go to snma.org, join, and become a member. Also, you can join the Health Policy and Legislative Affairs Committee, where we discuss all of this. And SNMA also has several other national committees and strategy teams, so you can find out what you're passionate about and grow in that area. And then lastly, we invite you to join us at AMEC. The conference is in Orlando this year, April 13th through the 17th. So we thank you again and have a great evening.
Bye-bye.
Bye-bye.